If your back hurts after sitting, driving, working, or waking up in the morning, this video is for you. Today is a simple 10-minute back pain exercise routine you can do at home with no equipment. Designed to loosen tight areas and build support around your spine. Stay to the end because the last move is a feel-good stretch that many people say gives instant relief. Important: back pain has many causes, so this routine is for general stiffness or mild, non-emergency back discomfort. Stop and get medical help if you have severe pain after a fall. Pain with fever, loss of bladder, bowel control, numbness in the groin area, or increasing weakness in a leg. Also stop any exercise that causes sharp shooting pain down the leg. Move only in a comfortable range. Most back-friendly routines focus on two goals: improve flexibility in tight muscles and improve strength in the core and hips so the back isn't doing all the work. That's why today includes gentle stretches plus stability exercises used in spine conditioning programs, warm-up breathing plus brace one, belly breathing plus gentle core brace. Lie on your back, knees bent, feet flat. Inhale through the nose and let the belly rise. Exhale slowly and gently. Tighten your stomach like you're bracing for a light poke. This teaches control without holding your breath, which helps protect the spine during movement. Mobility to reduce stiffness to knee to chest. Stretch. Pull one knee toward your chest. Hold about 5 seconds, switch sides, then try both knees together if comfortable. Keep your spine gently pressed toward the floor and avoid jerking. 3. Lower trunk rotation, knees bent, feet on the floor. Let both knees fall slowly side to side like windshield wipers. This is a classic gentle motion to restore low back movement. Strength to support the back for pelvic tilt. Flatten your lower back toward the floor by tightening your belly and gently tilting the pelvis. Hold 5 seconds and release. Think, zip up the core, not push hard. 5. Glute bridge, push through your heels and lift your hips, squeezing glutes. Pause, then lower slowly. Glutes help take load off the low back during standing, walking, and bending. 6. Modified side plank, on your side with knees bent, elbow under shoulder, lift hips and hold. This targets side core muscles that stabilize the spine. Flexibility. Finish. 7. Child's pose. Prayer stretch, sit back toward your heels, arms forward, relax your neck and breathe. Keep it gentle. Stretch should feel relieving, not painful. 8. Hip flexor stretch, if you sit a lot, hip flexors tighten and can pull the pelvis forward. Stressing the low back, stretching them can help many people feel looser. Kneel on one knee, use a cushion, tuck the pelvis slightly, and lean forward a little. Try this routine once daily for a week, then 3 to 5 days per week for maintenance. Consistency matters more than intensity. If a move increases pain, reduce the range or skip it and focus on the ones that feel good. Repeat this with me. Progress is not pain, progress is practice. A stronger back is built one small session at a time. If this helped you, like this video, share it with someone who sits all day, follow for more quick routines, and subscribe for weekly back-friendly workouts and posture tips.